For a deep inferior epigastric perforator flap reconstruction of the breast, one technique to maximize the amount of volume captured by this procedure is to do what's called a delay. A delay of a flap means arresting the blood flow that is coming from an alternate source, as opposed to the blood flow that is based on the source that you are planning to use for your reconstruction. This is done by having an understanding of the anatomy of the DIEP flap. There are two sources of dominant blood flow to this flap. One comes from the deep inferior epigastric perforator, which is why the flap is called as such, and the other comes from the superior epigastric vessels. So for a delay, you would arrest the blood flow from the superior source by ligating it, and thereby improving the amount of blood that's coming from the inferior vessels. You can also select which vessels you want to use. For example, in a unilateral reconstruction where you just need one source vessel, you can ligate the other side where the blood flow is crossing the midline coming from that side to supply the side you're using to reconstruct your breast. So this is an excellent technique. You can do this by either arresting the vessels like we discussed. You can also do this by creating the incisions around all the areas that you would like to eventually harvest for the reconstruction. That's called a surgical delay as opposed to a vascular delay, which is where you stop the blood flow from the sources you do not want to use.